Good morning and welcome to Radio Friends on Monday, November the 26th. Good to have you with us today. We're going to talk about arthritis. And does it really does the weather really affect you in arthritis? There's no scientific proof that it does, but we know it does.
That's right.
I want to introduce you to Dr. Ben Hansen from Missouri MU Healthcare, MOI. Good to have you here, Doctor.
Thank you.
We were talking about that before we started.
Yeah.
Many people will tell you that they can feel when the weather is changing that it affects the arthritis.
Yes.
Right? And you
Yes.
said?
I say every day I hear that from patients.
But there's no scientific proof
Yeah,
that it
the
does.
scientific studies are lacking in showing proof of that. There are studies that show a correlation, right? And that a certain number of people are accurately able to predict the weather, or their severity of arthritis symptoms do seem to get worse, and they can show that in the study.
Yeah.
But the studies are conflicting and aren't really great at proving that point. But every day in my clinic, when the weather changes, there's some people in there saying, I know it's true.
Yes,
and,
of course it is.
And
because before I
most of the time they're right.
Yes,
they have arthritis.
Before I had the ankle fuse, I could pretty much predict the weather better than the forecasters could with the pain in the ankle. But what's the best thing to do for arthritis? This is what you specialize in, right?
That's right.
Arthritis?
Arthritis of the hip and knee is what I specialize in. But the process in the other joints is very similar.
So what's the best thing to do if you have arthritis? How do you relieve that pain?
Probably the best thing to do is keep moving. Okay, focusing on your overall health, I think, is the first thing. Stretching, strengthening, nutrition is probably the first step. And then we have over-the-counter anti-inflammatory medications and things. Things like Tylenol and ibuprofen, Aleve are probably the first line treatment for arthritis. But I really emphasize to patients that your overall health and activity level does help you deal and function at a higher level with your arthritis pain.
So don't give in to the arthritis.
Yeah, arthritic joints feel better when they move.
Right.
Okay.
But
motion.
Now you mentioned the over-the-counter like Aleve. Is there a danger of staying on a product like Aleve for long term?
Sure.
Can it not have effect on your liver?
Your stomach and your kidneys are the most common places where it can affect adversely. Primary care doctor or a physician should monitor people that are on anti-inflammatory medications for long periods of time.
And what do you call long periods of time?
Years.
But if you're taking it for a couple of months, that's not going to do anything?
Usually not.
Okay. So if you got a flare-up of arthritis and you want to take Aleve or a product like that for a couple of weeks or a month or so, that's not considered long-term.
That's right.
But if you stay on it longer than that, you should tell your primary care physician and monitor it.
That's right.
Okay. We're just about out of time, but is there any food that you should stay away from or you recommend eating with arthritis?
I just think a diet that's high in nutrient-dense foods, vegetables, fruits, protein. I think inflammatory foods that increase the inflammation in our body, like refined carbohydrates.
It's not good.
Not good.
Good. What about a glass of wine?
I think that's okay.
Okay.
Yeah.
I said that. All right. If you want more, Dr. Ben Hansen, thank you so much for coming by.
All right. Thank you.
Pleasure meeting.
Thank
Tell my
you.
friend, Dr. Kyle Fiala, I said hi.
That's right.
All
Okay.
right?
We'll do that.
All right. If you want more information, you can go to the website. It's www.muhealth.org/MOI. They're a wonderful group of people over there.